Hello, my name is Tony. I've been asked to tell you a little bit about what's happened to me here at Dr. Jotti's office. And I must say right from the very beginning, the reason we're here is because of my wife. My wife had a very scary, life-threatening situation that is a story in its own. But after 5.5 months of being switched from one doctor to another, within 2.5 months, Dr. Jotti has her back to 98% of herself without any medication and without any invasive procedures, which to me is mind-boggling. And the reason I've agreed to do this, frankly, is I feel an obligation, and I mean this very sincerely. If I can help somebody else to take this treatment and come away from that utter despair that we were in and rejuvenate their lives and the lives of their grandchildren and everyone else around them as we have, I feel a sense of duty to do that. And so I'm going to tell you my story. That's a tiny little story compared to some of the things we hear around here on a daily basis, but I've been under doctor's care for over 40 years based on hypertension. I've been taking blood pressure medication since my 20s. Cholesterol medication for the last 10 years due to high cholesterol numbers. Arthritis pain relieving medication, non-narcotic but nevertheless very strong medication that, because I've had arthritic issues in hips and hands and feet, those arthritic conditions were so severe that the answer I was given was take anti-inflammatories and pain medication until the symptoms dissipate a bit. The hip arthritis was so severe that about a year ago I had a hip replacement on the left side and was scheduled to have the other one done, which was deteriorating, but apparently not at the same rapid rate the left side was. I was supposed to have that done in September, but because my wife was so ill, I put it off to May. I'm convinced I'm not going to get that other hip replacement because I don't need it anymore. Now, along with that, I had these allergy issues. Every time I'd come to the desert, I'd have severe allergy problems where the whole left side of my face and nose and the eye would be severely affected. Both my eye and nose would run regularly. The arthritis in my feet really have peaked out in about the last 6 months. I've had severe pain from the arthritis in my feet to the point where a few weeks ago at a business meeting, I actually rented a wheelchair and had that wheelchair put in my room because I couldn't put any weight on my foot. And what I did was just start taking my anti-inflammatories again and my pain medication, and I could hobble around at the meeting. Okay, after 12 days of treatment with Dr. Jotti, here's an update on where I'm at today. My foot pain's fine, and it's not coming back because it's reduced down to almost its normal size now instead of 1.5 times its normal size, which it has been for a very long time. I mentioned I'm not going to get the second hip replacement because I don't need it. I know right now I'm not going to need it because there's no pain. My high blood pressure medication, it's down to half, soon going to a quarter. I felt there's no need to take the medication if my blood pressure isn't high, and I've been checking it regularly, and I know it's under. Typically 115 over 65 is what I've been getting lately. The pain medication, the non-narcotic pain reliever called Ultram, pretty strong stuff. I'm right down to a quarter of what I was taking, and next week I'm going to cut it out completely. I could cut it out right now because I'm not having any pain. I don't take any more allergy medications. I have a bunch of Nasonex for anyone out there who might want some Nasonex. And my cholesterol medication, I don't take that any longer either. Of course, I'm going to have a full blood workup to be sure that those numbers are all the way I believe they're going to be. But all this has happened simply with a dozen days of treatment. And I guess the very bottom line is the two greatest benefits to me personally were the sense of well-being I haven't had in a long time, the sense of feeling really good and not feeling like a guy who's going to be turning 65 here pretty soon. I feel not a great deal different than I did when I was in my 40s. I know that sounds absurd probably, but it's simply the truth. But the other big thing I see is my mental alertness, my mental drive. I'm the president of a small company which I started 21 years ago, and the company has grown very nicely, and I found myself delegating things to people that when I found a situation that was difficult to deal with, I'd simply delegate it rather than have to deal with it myself. Now I welcome it. I feel very confident and very mentally alert and very mentally youthful. So that's my story, and thanks for the opportunity to